Hi, good day everyone. Today, we are about to show you a laboratory test procedure. The test is the HCT-HGB test or Hematocrit Hemoglobin test. A hematocrit test is a simple blood test that measures the percentage of red blood cells in your blood. Red blood cells are important because they carry oxygen throughout your body. Test results showing low or high hematocrit levels may be signs of blood disorders or other medical conditions. The procedure. First, greet the patient, introduce yourself, and identify the patient. Two forms of active identification are required. Ask the patient or the caregiver to state the patient's name and date of birth. This information must match the requisition.
Good morning, ma'am. I am Mary Feliz Isabelle and I am your medtech for the day. May I know your name, ma'am? I'm Marvin. Your age? I'm 23 years old. Okay, so
Second, explain the laboratory test and reassure the patient that the minimum amount of blood required for testing will be drawn.
today we are going to perform skin puncture for your hemoglobin and hematocrit test.
Third, put on gloves. Fourth, prepare the materials that will be used in the test. Materials include lancing device, lancet, dry cotton, alcohol swab, capillary tubes, sealing clay, and microhematocrit reader. Fifth, position the patient so that the hand is easily accessible. Sixth, cleans the puncture site. Third or middle finger or fourth or ring finger with alcohol swab. These will remove bacteria that could be pushed into the puncture and might cause an infection. Then, let it air dry. For the seventh step, using a sterile lancet inside a lancing device, puncture the fingertip slightly to the side of the center and across or perpendicular to the grooves of the fingertip. This enables the blood to form as a drop. For the eighth step, wipe the first drop of blood with a cotton. This is because the first drop of blood may be contaminated with the alcohol used for disinfection, which may provide an inaccurate result. For the ninth step, allow another large drop of blood to form. Lightly touch the capillary tube to the large drop of blood. Collect drops of blood into the collection device by gently massaging the finger. Avoid excessive pressure that may squeeze tissue fluid into the drop of blood. For the 10th step, fill around 3/4 of the capillary tube with blood. After that, seal one end of the capillary tube with sealing clay, about 3 mm. Then, prepare the microhematocrit centrifuge instrument. After that, put the sealed capillary tube with blood in the microhematocrit centrifuge. Then, centrifuge the blood at 10,000 rpm for about 4 to 5 minutes. After centrifugation, determine the level of packed RBCs using microhematocrit reader. Then, as soon as the laboratory test is done, discard the used materials in the proper trash bin. Always remember to separate the infectious waste, non infectious waste, and also the sharps.